While Americans grapple with increased closures and restrictions, many seniors are facing near total isolation in this country. White House guidance warning them to stay at home. Senior centers closing their doors, nursing homes restricting visitors, posing new mental health risks for the elderly, loved ones finding alternatives like this one. Some grocery stores also creating new hours for highly vulnerable groups. Joining me now is Mark Meridy, Executive Director of DOROT, a New York-based nonprofit that provides programs and services to seniors, a very important organization in this very critical time in our country. Mark, great to have you with us. Let's talk a little bit about the mental health impact on seniors and why it is so important to try to find new ways to address this right now.
Sure. Well, social isolation and loneliness is a serious risk to public health. We've known this before the coronavirus. Social isolation and loneliness leads to devastating healthcare consequences, increased levels of high blood pressure, early onset of dementia, and a recent study was just recently released a few years ago, which said that social isolation and loneliness can be the equivalent of smoking 15 cigarettes a day. So this is a very serious problem, and it's a serious risk to public health. But now when we add on top of it the coronavirus, these vulnerable individuals are going to be even more at risk for social isolation and loneliness.
Mark, I live here in New York City. I've seen some signs and flyers around the neighborhood where I live, people saying, messaging out to the elderly not to go to the supermarket. They would go on their behalf, trying to get some volunteers to run errands on behalf of those that are vulnerable and at risk. What are the best ways people can help right now, specifically with the issue of isolation? What can people do to combat that isolation?
So I think the safest way is to use the telephone, use smart technology, so that people, if they do have smartphones, that they could use FaceTime or WhatsApp. The most important piece, though, is to reach out to your neighbors by giving them a phone call or by knocking on their door. But the critical element here is that people need to keep their distance. We have seen that with the coronavirus, that the most vulnerable individuals who can suffer the greatest are those people who are over the age of 80. And we're in a real dilemma because with the coronavirus, that with that level of risk, we are only increasing the social isolation, but we have seen from the statistics around the globe that those people who are over the age of 80 have a much greater risk of being affected negatively by the virus and actually dying from it.
And from the perspective of seniors, what should seniors be on the lookout for right now in terms of help, but also a lot of the misinformation that's out there?
Huge amount of misinformation. And one of the things that I think for older adults is to really reach out to their friends and to their neighbors by using their telephone to check in with them, and for family members to check on their older relatives. I think one of the things that older adults need to be particularly careful of, that there are a lot of people that are looking to help at this particular juncture, but there are always individuals that are looking to take advantage of the situation, and seniors should never, ever provide any personal information over the phone. No social security numbers, don't give out your credit card information. Even if somebody is offering to go shopping for you, don't give that information out. There's always been a lot of scams of people trying to take advantage of the situation. It's really unfortunate, but it's something that we need to be aware of.
All right, Mark Meridy, thank you very much with that important piece of advice for everyone involved trying to help across this country.